In today's broadcast, we delve into recent developments concerning viral outbreaks worldwide, focusing on emerging threats and the corresponding health responses. Health authorities in the United Kingdom are currently addressing a case of Lassa fever, a viral hemorrhagic illness akin to Ebola. The individual, who traveled from Nigeria to the UK in late February, was diagnosed upon returning to West Africa. Lassa fever, endemic in Nigeria and other West African nations, can lead to severe symptoms, including bleeding from the eyes. However, the UK Health Security Agency, UKHSA, assures the public that the risk remains very low, as the virus does not easily transmit between individuals. Efforts are underway to trace and monitor anyone who may have been in contact with the infected person to ensure appropriate medical care and testing if symptoms develop. A recent documentary has reignited discussions about the origins of the COVID-19 pandemic, suggesting a potential leak from the Wuhan Institute of Virology. The film highlights testimonies from experts, including Dr. Robert Redfield, former head of the U.S. Centers for Disease Control and Prevention, who posits that the virus was engineered for human transmission. This perspective raises concerns about a possible accidental or deliberate release. The documentary underscores the necessity for global attention to potential lab origin risks to prevent future pandemics and calls for further investigation into the pandemic's roots to avert similar catastrophic outbreaks. In a tragic incident, Betsy Arakawa, wife of actor Gene Hackman, succumbed to hantavirus pulmonary syndrome, a rare yet lethal disease primarily transmitted by rodents. The virus initiates with flu-like symptoms that can escalate to severe respiratory issues. Hantavirus spreads through aerosolized particles from rodent excreta and, less commonly, through bites. While human-to-human transmission is rare, the disease can cause fever, bleeding, and kidney damage. Vaccines are available in certain high-risk regions, such as China, serving as the most effective preventive measure. Despite its severity, hantavirus does not currently pose a widespread public threat. Experts are sounding alarms over the H5N1 bird flu strain, which has begun infecting mammals, including cows, and has led to human cases. Although current human infections have been mild, there is apprehension that the virus could mutate, facilitating human-to-human transmission. Recent studies suggest that the virus might spread via wind, particularly in poultry farm outbreaks. To mitigate this potential threat, experts advocate for accelerated vaccine development, especially mRNA vaccines akin to those used for COVID-19, enhanced pandemic preparedness, and global cooperation to ensure equitable vaccine access. The World Health Organization classifies bird flu as a priority pathogen with pandemic potential, and historical data indicates a high mortality rate of 52% in H5N1 infected human cases, with 400 deaths reported globally since 2003. An epidemic of a new variant of clade mpox, referred to as clade IB, commenced in Central Africa as early as September 2023. As of 2024, over 29,000 cases have been reported, with more than 800 fatalities, predominantly in the Democratic Republic of the Congo, DRC. The World Health Organization declared the epidemic a public health emergency of international concern on August 14, 2024. Mpox, formerly known as monkeypox, is endemic among small mammals in Central and Western Africa and can infect humans. Symptoms include a rash that forms blisters and then crusts over, fever, and swollen lymph nodes. While the illness is usually mild, severe cases can occur, especially in children, pregnant women, or individuals with suppressed immune systems. An outbreak of Oropouche fever began in December 2023, with over 9,852 infections reported, marking the first occurrences outside the Amazon region where the virus is endemic. While most cases have been in Brazil, local transmission has also been reported in Bolivia, Peru, Colombia, and Cuba. Cases among travelers to the region have been identified in the United States and Europe. As of August 16, 2 fatalities have been reported, the first known deaths caused by Oropouche. The virus is transmitted by biting midges, specifically Colicoides parensis, and causes symptoms such as fever, headache, nausea, vomiting, and muscle, joint, or eye pain. No vaccines or treatments currently exist for Oropouche fever. These developments underscore the dynamic nature of viral threats and the critical importance of vigilant surveillance, rapid response, and global collaboration in safeguarding public health. As new information emerges, health authorities worldwide must adapt and coordinate efforts to mitigate the impact of these and future viral outbreaks.